Hello, my name is Javali Warwick, Program Manager for Nurse Delegation here at Home and Community Services. For this training, we're going to talk about planning and implementing in the nursing process. Clients receiving nurse delegation in their own private home will require that the nurse delegator set up a chart for the client. In this chart, the nurse delegator should include the nurse delegation forms, medication orders, medication administration records, credentials for the long-term care workers who are delegated, and any progress notes. The nurse delegator will want to provide written instructions. In these written instructions, the nurse will provide step-by-step instructions to perform the nursing task, any predicted outcomes or side effects, and to whom does the long-term care worker report side effects. They will teach the long-term care worker to perform the task to these step-by-step instructions, and they will determine caregiver competency in one of three ways: return demonstration, verbal description, or record review. Delegation is at the discretion of the nurse performing the assessment and delegating the task. This includes delegation of insulin. In the instructions, the nurse delegator will want to provide rationale for the delegated task. Make sure that the instructions are specific to the client and their condition. This is non-transferable among clients. Provide clear written instructions, expected outcomes, and side effects. It is important that the nurse provide instructions on what side effects or outcomes the long-term care worker must report to the nurse delegator, the physician, or when to call 911. Also, the nurse will want to provide instructions on how to document. If the nursing task is medication administration, the nurse will want to verify how the medications were prescribed. They will want to review pharmacy lists, medication administration records, or speak to the healthcare provider. If the nursing task is medication administration, the nurse will need to verify the prescription. They can use a pharmacy list, medication administration record, or speak to the healthcare provider. The nurse must verify medication changes and document how they were verified. They will need to determine if retraining of the long-term care worker will be required, update any delegation paperwork, or update instructions and task sheets. For insulin delegation, the nurse delegator will want to teach proper usage of insulin, instruct and demonstrate safe insulin administration technique, determine competency of the long-term care worker performing the task. They will want to verify the long-term care worker is competent in drawing up insulin from a syringe, dialing the dose of insulin on a pre-filled syringe, and administering insulin. For competency, the long-term care worker must be evaluated once a week for 4 weeks on initial insulin delegation. Initial insulin delegation must be performed in person with the long-term care worker, the nurse delegator, and the client. The 3 subsequent visits must be 7 days apart. After initial delegation, the nurse may verify competency either through verbal or demonstration of the task. Each subsequent visit must be completed 7 days apart. The nurse delegator can verify competency either by observation, verbal description, or record review. So when is delegation required for insulin? No delegation is required when handing a pre-filled syringe to a client, dialing the dose, verifying the correct dose, putting the needle on the end of the insulin pen and handing it to the client, or insulin device setup. Delegation must occur when insulin is being drawn from an insulin syringe. Delegation must occur when insulin is being drawn into a syringe from a vial, and injection of the insulin into the skin. The requirements for the long-term care worker to be delegated this task is the 9-hour nurse delegation for nursing assistants and the 3-hour special focus on diabetes. Please note that long-term care workers who will only be doing glucometer checks are not required to take the 3-hour special focus on diabetes. The nurse delegator is responsible for teaching the tasks specific to the client's needs, performing weekly visits for 4 weeks, validating that the client is stable and predictable, and nurses will expect that additional units will likely be required to perform this delegation. The nurse delegator will be required to perform evaluation every 90 days. There is no exception. There are 2 components to a 90-day assessment, also known as a supervisory visit. The nurse delegator will be required to perform a head-to-toe assessment of the client, assess the client to determine if they are still stable and predictable, and evaluate their response to the delegated nursing task. The second component to the 90-day evaluation for nurse delegation is evaluating the long-term care worker. The nurse delegator may assess competency in one of 3 ways: observation, record review, or verbal description. However, please note that on initial delegation, the nurse delegator must observe the long-term care worker performing the task. The nurse delegator will assess the long-term care worker, any documentation that has been submitted in the last 90 days, and validate the credentials of the long-term care worker. In this section, we talked about planning, implementing, and evaluating in the nursing process. For any questions related to nurse delegation, please contact Home and Community Services at nursedelegation@dshs.wa.gov. Thank you.